Sorry. I thank Senators very much for giving me the opportunity to come and to listen to you and the important issues that you've raised, and first and foremost to recognise again the women and their families who are impacted. And so many people in this room have either been impacted very directly personally, or have a close family member. I am no different, and recognise the importance of breast check in diagnosing breast cancer and the ongoing care that it gives to women. And I also just want to say very clearly, I have every confidence in the breast screening service that we have, and every interest in expanding it in ways that are scientifically appropriate. Absolutely no difficulty with that, but I want to make sure that the science is there first, that we are expanding it based on the science. Can I just go into the screening programme? I was in Eccles Street speaking with the radiographers and radiologists, and they were very clearly acknowledging the limitations of any screening programme. It is a screening programme, so it is never going to pick up 100% of people. And they were saying to me, of course, you must understand the balance though. If we pick up 99%, it's worth doing. There's going to be, there are inherent known limitations to screening programmes, but that doesn't mean that they aren't of very considerable value in reducing an overall disease burden in a population generally. So we just have to recognise that screening is not diagnostic. And even a screening programme at 99% excellence is going to miss things, and there will be harms done. But we know the evidence that we have been able to pick up with screening programmes and the value that they are in themselves, and that is important. And so we try to think about the best way of extending screening programmes. And there is a very significant cost element, and let's not, we will have to deal with that a different day on estimates and so on. So we've got to get the right balance about expansion. It has already expanded to 50 years to 69, it had been 64. And we are conducting this assessment about how to extend it best. So is it 45 to 49? Is it 70 to 74? The breast density issue. And that needs to be a scientific analysis. On the breast density piece, I'm so glad that so many senators have raised it and had such important focus on it. And I do want to thank Martha Lovett-Cullen as well for her contribution to the debate today, and recognise her very important words on behalf of her mother. And I really do hear what senators are saying. I would make the point that I am a politician and I'm not able to make a scientific decision on it, and no more than the screening programme. During the programme for government, as I think I mentioned to you before, we considered extending the ages and then realised that none of us knew what we were talking about, and that we should ask the actual people who knew what they were talking about. And in the same way with the breast density issue, there is competing evidence at a European level about how that is best done. Breast density has obviously gained greater attention, and as you've already described how it appears on a mammogram. So there are differences in international clinical perspectives on the effective integration of this in breast cancer screening. As I've said, the recently updated European Commission initiative on breast cancer, European guidelines on breast cancer screening and diagnosis, that talks about the low certainty of evidence incorporating breast density measurements into population health screening programmes. That directly contrasts with the recommendation of the European Society for Breast Imaging, which recommends that women with extremely dense breast tissue be offered screening with breast MRI. So we need to have a scientific reconciliation of those pieces of evidence. We thankfully remain in a democracy that does rely on experts, and this work will take about 18 months, and I would ask for the senators to support me as I try to do that, that the experts are given the opportunity to do that. They tell me that most public population screening programmes like breast checks do not use breast density measurements, but I recognise there are those that do. So let us perhaps get the scientific evidence and take the best steps forward, recognising that there will be a cost which we will have to address together. Recognising that, senators will be aware that the NDP review is coming up, and I would encourage them to get on to their favourite cabinet ministers about investment for health infrastructure right across the country. But that is a little shameless of me. But of course I want to extend hospital infrastructure right across the country. Nevertheless, there have been important budgetary supports that have enabled us to increase the number of consultant radiologists. There are 185 in the system working today, but we have 43 training places, which is an increase of 5%. That is a really important investment that will make a difference to the time. I'm conscious senators have raised the do not attends in breast check, and it sort of doesn't sit well with me that almost 50% of appointments that go out with a time and date for a mammogram, for a screen, are do not attends. And that just doesn't work. It just doesn't work, and we have to try. We take some steps to try to address do not attends across the health system, and there are some centres, for example, I was at the Sligo Chronic Disease Management Hub, who have managed to make real progress with their do not attends. But at the end of the day, people do need to turn up to appointments and have the benefit of them. I would also say, in relation to the very important, the underserved populations. I recently funded a project through the Women's Health Fund to deliver education on how to be aware of symptoms, specifically for underserved populations, and we're doing that in partnership with the Mary Keating Foundation, which I think is an important measure. On the, I thank Senator Costello in particular for the range of different questions, and I will follow up on every one of them to the extent that I can. Some of them are clinically based decisions, and I will need better information in relation to them. But for example, you're quite right to highlight lymphedema, for example. There's 2,000 people, I think, with chronic lymphedema in this state, and the risk is, as you say, ever present and very, very important. There are some clinical questions there that I personally can't address, but will ensure that you get a proper answer to them. And in relation to the KPIs, my understanding is that the most recent data is available from September 2024. And I can provide detailed information to you on that. It's possibly better. But I do thank the senators generally for their focus on this, for their really genuine focus on this. And I would make the point that while we spend this time talking about breast cancer, we must equally consider people who are not getting lung cancer diagnoses for the absence of a screening programme, colorectal cancers, and the range of other cancers that are very important. And we could have an equal debate about any one of those. And I suppose on the point in relation to Donegal, I would make the point that I think the surgical capacity there is very important, and that we want to see surgeons having the opportunity to continue to perfect and develop their craft in Letterkenny as much as anywhere else.
Minister, thank you very much. As